Hi, welcome to the Pinoy RN, a podcast that provides insight into a variety of subjects relevant to Pinoy nurses. Here's your host, Jerome Babate.
With um, Western Mindanao Medical Center in Zamboanga City, where I was a emergency room nurse and then an OR nurse. And then I also had the opportunity to teach at my alma mater, Western Mindanao State University, as a clinical instructor. And then my first tour abroad was in Mecca, Saudi Arabia, where I was a nurse, staff nurse at the male urology, vascular, ENT, and plastic surgery unit, and then went back to the Philippines. Was able to teach at Makati Med, RTRMS College of Nursing, and 2007 I was here in Doha, Qatar, working with the Hamad Medical Corporation as a emergen- emergency nurse in their emergency department, sir. Yes, my first love really is acute critical care nursing. I
Mhm.
think during my school days, our classmates who are males would usually choose psychiatric and mental health, or you go for emergency nursing. So in my case, I opted for emergency nursing. When I that's I think you can, as I have mentioned a while ago, I my first assignment was really in emergency. And while here in Doha, Qatar, I started as an emergency room nurse and then proceeded to be the trauma nurse. And then when an opportunity came with the opening of the Neuroscience Institute, where they needed a stroke nurse, so I had the training and then additional certifications for me to be qualified with the stroke nursing. Stroke nursing is really very nice. So, as I have mentioned a while ago, I'm a guy who would like to have this adrenaline rush. Where in ED we do CPR, and then in trauma we do thoracostomy, and of course in stroke we do thrombolysis, where we save people's lives and of course take care of patients. We are lucky to have the multidisciplinary team with us in Hamad Medical Corporation, and all the equipments and resources available to take care of patients. So my day usually starts at 6 a.m., where I go to the emergency and take the admission list from the bed management. And then as a CNS, we are the one responsible to do the stroke patient list. The stroke patient list is the basis for our multidisciplinary conference. And then we do bedside rounds and attend to patient needs in emergency and inpatient, as well as what we have, we have what we call RASU. This is the rapid access stroke unit, where we do MRI, carotid Doppler, we do Holter, we do BP monitoring, and we do labs and the rest of the workup for stroke patient, minor stroke specifically, and the TIA patients. And then sometimes you won't notice time is already 3 p.m. and you are about to go home to your respective accommodations. Yes.
And of course, that
It is very essential. That is really the first thing where we meet the multidisciplinary team. We are lucky to have a number of staff in our team. We have the pharmacist, we have the psychologist, we have the OT, PT, speech, we have the case managers, we have the charge nurses with us, we have the neurologist, and we have the rehab doctor. with this multidisciplinary team. Even in Qatar, nursing is very young. In fact, it was only I think 4 years ago where they started professionalizing nursing, where now they have the board exams for nurses who would like to practice here. Um, Before that, all nurses who come to Qatar would have to have their professional licenses from their own respective countries. So, like for Filipinos, you should have a license um, from PRC, and once your PRC license is um, what do you call this Jew, you will not be able to work here and function as a nurse. So you really have to renew your license because that would be the basis of your being a nurse here in Doha. Now that they have the professional body here, you are to do the same, take the exams, renew it, and submit the CPDs for. Clinical nurse specialist. It is really new here also. It all started with the establishment of, I think, the national program for cancer patients, where we had the opportunity to hire um, clinical nurse specialists from the UK to help us with that program. So, first wave of clinical nurse specialists here in Doha uh, were really from the cancer oncology nursing. So these are from UK and the United States, Australia and Canada as well, where they help the national program for cancer. And then this had a domino effect because the corporation saw it to be important and valuable. So they started hiring clinical nurses, clinical nurse specialist with all other specialties. So we have a two stream of our program here. We have what we call they hire a CNS from outside, or I among the first batch who got trained inside Qatar. So we have commissioned the University of Calgary to give us the Master of Nursing, and the track was really oncology nursing. So those were the first graduates of locally trained clinical nurse specialists here in Qatar. And for me, who was trained outside and who finished their masters back in the Philippines, we were given an opportunity to do our internship in the corporation and become also clinical nurse specialist after taking some exams and competency requirements. Yeah, so my certification is with the American Association of Neuroscience Nurses. I am a stroke certified registered nurse, SCRN. And for the local body here, certification is clinical nurse specialist, med surge, because this is my area of specialty back in the Philippines for my master's degree.
Interesting.
The same
Interesting.
is true with other specialties. So you have to have your master's degree on related fields, and you have to have certification or training or competency on that particular field of nursing. So various po tayo, meron tayong oncology nursing, a lot of CNS are there. We have pain management, we have wound care nursing, we have stroke nursing, we have what else do we have here? Yeah, I think those are the common areas. We in Hamad Medical Corporation, we have four streams. We have four tracks for nurses. You can either go with nursing administration, where you have staff nurse, charge nurse, head nurse, a supervisor, and the director of nursing, and then assistant executive, and then executive director of nursing. And then you have the research side. You have the research nurse, and then the research scientist, and then going up to executive director of nursing as well. And you also have In education track, you have the nurse educator one, two, and then the director of nursing education, and so on and so forth. For the practice track, clinical nurse track, we have the staff nurse, and then you do specialized nurse, and then clinical nurse specialist intern, and then clinical nurse specialist full pledge, and then you have the advanced practice nurse. So the CNS, if you look at the organizational structure, we are at the level of director of nursing of the admin side. So the best thing being a stroke clinical nurse specialist here in Hamad Medical Corporation is that the availability of resources that you cannot find anywhere in the world, I think, and I'm very proud of that. So we attend to patient needs, whether whether you are from any race, any religion, any from the laborer to executives. It would be the same care that we will be giving you once you arrive at our emergency. So we have the best ambulance system. Whether you are in the desert of Qatar, we can pick you up through our helicopter, or where you are at work, we can send the ambulance, and we're happy to be there less than 15 minutes or even 7 minutes, because our ambulances are really strategically located in areas where they are needed. And then we have, of course, the helicopter. We have the once you arrive at our emergency, we have all the necessary equipment. We have the stroke neurologist, we have the team there, we have the CNS, you have the emergency physician, of clinical pharmacist ready to receive this patient once you call our emergency. And then on standby, we have our state of the art MRI, we have our interventionalist ready to do the thrombectomy if needed. We have the neuro surgery team ready if we need to do craniotomy. And we have the medicine. The medicine thrombolysis altiplase is just ready for our disposal. So it's there, and you'll have your room available. We have our own stroke unit. We have our own hospital for rehabilitation. Our physicians are ready to take care of patients. And to tell you honestly, and these are all for free. This is the very advantage here when you are in Doha, Qatar. Yes.
Yeah.
So we give the best care always here.
Yeah, no wonder. That's
Yes,
very,
yes.
yeah,
We are a center of
appreciate that.
excellence for stroke care. We are accredited by the JCI, and our trauma is accredited by the Canadian accrediting agency. I think the first is the love of education. I always love to study, and not just myself, but I also share it with other fellow nurses. In fact, I always are keen to looking at what are the available programs out there for our overseas Filipino nurses, looking at the master's degree, doctorate degree, and that sort, or even just sharing ebooks and articles to our fellow nurses. That's the first one, love of education. I think the second one is enthusiasm to serve. I've always have this. I think for all nurses, we always wanted to serve, not just to for our patients, but also to the nursing profession. So with this enthusiasm, I am involved with organizing nursing organizations like the PNA, the ANSAP, the research group, and the like, the CCNAPI, of course, and our group with the diaspora. So that's it. I really would like to serve. Uh, Third one, I think, is with people who knows me, is my advocacy of financial literacy. So towards financial freedom. Uh, So most of the Filipinos are not into saving and investing. So this is what we do. We usually go to Filipino communities and teach on financial literacy.
Well, that's all for today's episode of Pinoy RN. Thanks for listening, and thank you to our guest for joining me today. Join us again next time when we talk about Filipino nurses and nursing. Make sure you subscribe to the Pinoy RN podcast on YouTube so you never miss an episode. Also follow us on Facebook at Pinoy RN Podcast. Special thanks to our event partners, Beta Nu Delta Nursing Society, Filipino Nursing Diaspora Network, Nursing for Humanity.